This is Dr. Francavilla. We at Suvinproducts would like to share with you an exciting new treatment option for your dental patients. In this video presentation, we will show a step-by-step demonstration of small diameter implants using both animated sequences and live footage. Let's take a look at one of the sequences. As an introductory exercise to acquaint the dentist with the feel of human bone density and can aid in the process of judgment for the optimal pilot hole site when first attempting the procedure in the mouth. Excessive heat generated during drilling should be avoided, since it destroys the bone cells and can lead to failure of the implant. Accordingly, use sterile...
And we're just going in easily. The implant's in the bone. You can close and swallow it.
Implants may be previously chilled to be... Insert the implant into the pilot hole through the attached gingiva desired angulation to give a path of insertion for the overdenture later. Please use a downward pressure with reasonable force. Turns should be only 1/4 advancements at a time.
I'm going to go to the ratchet. You can close for a second if you need to, Bill. Okay?
Yeah.
And go to the ratchet. That'll get us a little farther in, and then they go back to the wings.
In addition, in this DVD, the protocol for incorporating an overdenture is presented. In the areas where adherence is desired. Apply a thin layer of reline adhesive to the tissue surface and allow to dry for about 30 seconds.
To the denture. Okay, and then I'm also going to put some right around the housings themselves. Put the denture in.
Next, in part 2 of this DVD, we will present a discussion of the indications of small diameter implants using case studies.
A number of possibilities and see where the implants work with this. We're going to start with a case, well, initially, this is a case of a lower denture. What happened was initially this patient, he is now edentulous, but this patient had a cuspid and a bicuspid, one on each side, and with crowns we had built a bar across, and the denture, the overdenture at that phase had a number of clips which clipped onto the bar, and he was very happy with this because he had quite good adherence with the lower denture. Now, this years later, the two crowns have gone. We had to pull them. The result was, after this extraction, he's left with nothing, and he doesn't have a great ridge, and he's used to this comfort level of retention. So what we want to try to do now is to give them this back, and essentially it's kind of like giving back the roots of the teeth almost.
And finally, in part 3 of this DVD, we will show the use of cone-based computer tomography to create three-dimensional virtual images. Andrew Jackson of Evolution Dental Laboratories will discuss the analysis.
It has a larger frame, as you can see, to eliminate any type of motion. Motion in our airway passage is somewhere around negative 540. So once we do that, then we can get into somewhere around, give or take, starting at 300 and going up to 2200. So if I have a special interest, like this pocket here, and I want to see what's going on in the pocket, I would literally put, let's say, that slice 3 in the particular pocket, and I can see how deep the pocket is. Although on the 2-dimensional x-ray it looks fairly deep, on the 3-dimensional slice it is not as deep as it appears. But so now what we have to do is create the reality world, what we call our stone model, to the digital world.
This DVD is also accompanied by a manual in the form of a handy flip chart. The step-by-step procedure shown in this demonstration video will thus be reinforced by this quick reference guide. For a limited time, a second video entitled The ABCs of Dental Disease will be included absolutely free in this offer. It can be used as a handy patient education tool in the reception room. It presents current concepts of good dental health. Your patients will enjoy this guide to understanding the causes and prevention of dental problems. We hope this implant training kit will result in an expansion of treatment options you will be able to offer your patients. We at Suvinproducts thank you for your interest.